How did the sources of information get collected for this exhibit?
Okay, well, first of all, you need to know that this was a process that started in 2000. And we collect information from 2000 to 2003, the American Anthropology Association. Now, do any of you know about anthropology and what anthropologists do? Just say yes or no. Okay. Anthropology itself is a field that has subfields, right? And so I am a cultural anthropologist, which means I understand things cultural. In order for us to do this project, we had to work with other members of our subdiscipline. So we got very close and personal with the biological and the genetic anthropologists, with the linguistic anthropologists, looking at the relationship between language and culture, because they both go hand in hand, and archaeology. There was a lot of archaeological evidence before the genetic um, evolutionary evidence came to being that we all came from a one place, right? That humans all arose in Africa. Well, the social and political environment was not conducive to people wanting to believe that, given what we've talked about already. How can all of us have come from this place, this one place? And so it was the working together of the four subfields that we even came up with the idea. If we were to say something about what race was and what race wasn't, what do we bring to the table that, for example, a political scientist, sociologist, or psychologist would not bring? And what we bring is that deep look at humans from four different perspectives, from their ancient origins, from their biological origins, from their linguistic origins, as well as from their cultural origins. That is, what do they create as cultural systems? So all four of those subfields worked together up till 2003. When we got our first grant, which was from the Ford Foundation, we had four national conferences. And we put together a national advisory board. And that national advisory board was made up of counterparts. We're the American Anthropology Association. So our political science, sociology, history, ethics, theology, law schools, schools of education, medical schools. We had 17 different disciplinary associations that worked with us to come up with a plan so that if we were to say something to the general public about what race was and race wasn't, what would we say? And so I chaired the National Advisory Committee that brought all these people together for 4 years, 3 years, 4 years, to hash all this out. And so it was scientists and scholars and people who had differences of opinion, but in the end, we all decided that this topic was so important for the future of our nation, because it is a topic that people don't want to talk about, right? If we can't talk about who we are and our identities and how we came to be as we are, how can we even begin to think about changing that? Particularly when so much of the information is misinformation. So one of the things we wanted to do is, even once the exhibit got up, was to have a way for people to be in contact, right? If you had questions for scientists, you could ask them. And we tried to do that. And going forward, obviously it's a lot harder to do, people get together. But it's something that I would like to do before the exhibit in 2018. that's when it's going to stop traveling around the country. So that's my answer to that question.
Thank you.
What's your intent in depicting races as separate in this exhibit?
What we wanted to do was to go where people are and bring them where we want them to be. That is, people already think races are separate. So it's not that, it's like we start where people are, right? We had done some research before we put the exhibit together, and we knew people believed in biological race. They believed that race was different and believed that, particularly in the US, based on skin color, because that's our history. And we had people who said, well, why do you want to focus on the US? Well, because it's a very powerful notion that we have to dissuade people from if we're going to move toward we are all the human race. So we can't just say it, because we've been saying it since 1968. You see what I'm saying? Science has been saying it. The scientists have been saying it. We knew that back then, right? But it's ordinary, everyday, lay person who believes race is biologically real. So that was the group we're trying to get at. And let me say, my own students, when I would teach, say, there's such biological race, they got that. But then nobody told them or explained to them, why do we put different skin? So human variation is left out of that equation. So part of this exhibit was taking all of that stuff and bringing it together in one way. That is, race is not biological, it's social construct, but it's a powerful social construct that has constructed the way we see reality in this country based on our history and our laws. Our laws made them real, made that difference real. So to undo that, you have to understand all of that. And the third piece, nobody ever talked about, certainly we did, scientists, there's no such thing as biological science. It is a cultural construct that we created it. Nobody wanted to talk about the consequences of us believing that was true on different people in our society, which is why we had the third part, and that is structural racism that exists today as a result of believing race was biologically real. And it continues to have repercussions. So we still say race is not biologically real, but what we culturally believe about race is very real, and it has real consequences. So if we don't understand all three of those things and how they all work together, then we don't have the ability to really take it apart, because we're only dealing with one particular part and not all three parts. So that's why we did it the way we did. Now, we ultimately want to get to the point in our society, and I think we have to, if we're going to exist as a democracy, where we understand it has had consequences, but we don't want it to continue. And so we have to not just deal, as I say, with each other as individuals, ensure that we all respect each other as individuals, but it's understanding how structural systems also collude or are part of the problem. How do you stop banks from doing what they do? How do you stop redlining and greenlining in terms of selling people houses? How do you stop those things that are sometimes invisible in our society, that continues to keep the structural racial differences in place? So I hope that answers your question.
What does the future of racism look like?
Well, I'll go back to where I left out, right, on the last question. It has to do with us understanding why are there disparities, like the young woman who asked me about the cash, about wealth. It's not just about education and about income. It's about wealth and how wealth is accumulated, gets passed on. That's one. In the area of education, for example, why is there achievement gaps among different groups of people? Well, we need to understand where people live, the kinds of schools they go to, the kinds of curriculum they have. I lived in New York City, in Manhattan, for 8 years, and the kids who came to our university, the New York City schools versus the Long Island schools versus some of the New Jersey schools, were not ready for university work. They were not ready, not because they weren't smart. They weren't ready because they didn't have physics. They didn't have trig classes. And so they came to the university at a disadvantage. Many of our students here in California, English is not their first language. And in some cases, it's not their second language. So how, as a system, an educational system, are prepared to deal with those students who are bright, but who don't have the opportunity? So it's asking those kinds of questions rather than saying a cookie cutter example works for everybody. And I'll just give you one last example from health. There's something in the healthcare industry, for those of you who are going to become nurses and doctors and healthcare workers, called health disparities. And if you look at who's the healthiest in our country and who's the least healthy in our country, you can probably do that based on what we call racial ethnic differences. This is a problem. This is a major national problem. And researchers are trying to understand that. But the only way they can understand it is structurally, not by one individual at a time. What are the structures that prevent whole groups of people from having access to care, access to all of those things that help them stay healthy, or that put them in categories where they're prone to have more diseases that are fatal in the end? And it's something that both the Science Foundation and the National Institute of Health are very interested in. So race will be around for socially, social race. And so an understanding of how race institutions will continue to work. So hopefully that answers your question.
Yes.
We're not done yet.